Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Alisa Sano. She is a public health research assistant. Her Kevin MD article is titled, "Don't Lie About Medical Errors, Apologize." Alisa, welcome to the show.
Thanks so much for having me. I've been
Well,
following your platform since 2011, so I'm so excited to be here.
well, thank you so much for joining me. Alisa is joining us from Tokyo, Japan. I understand it's 3 in the morning over there, yes?
Yes, correct.
Well, thank you so much for getting up. And we'll talk about your article in a little bit, but first off, just briefly share your story and journey to where you are today.
Sure. I grew up in rural Japan with my grandparents and my single mom, who is a pianist. Playing the piano was a big part of my youth. That and the English language and American culture, which I naturally gravitated to. And I self-taught English until I went to an international school for high school and then went to the University of Michigan, where I studied pre-med and medical anthropology. Clinical experiences there as a medical scribe and interpreter led me to my interest in med school. And the problem with that was, as an international student or non-green card holder, I had a very limited choice of US med schools to apply to. And the med school I went to, I ended up quitting after realizing that their unique curriculum would not help me secure my work visa during the residency, nor would it help me become the type of clinician I wanted to become. I did not want to do a disservice to my future patient populations because I lost my grandfather to medical mistakes, and that was really important to me. So it was one of the toughest decisions I had to make. So after withdrawing from med school, I shifted towards population health and studied public health at Johns Hopkins with a focus on HIV epidemiology and clinical informatics. Currently, I'm working as a public health auditor and doing research on the association between heart failure and HIV status via studying inflammatory biomarkers.
So let's talk about your Kevin MD article. It's titled, "Don't Lie About Medical Errors, Apologize." So how did this article come together?
So growing up as the daughter of a single mom, I was really close to my grandfather. So losing him to medical errors hit me really hard.
Hmm.
To this day, I still have this unresolved feeling after almost 10 years. And it wasn't so much that medical errors happen that bothers me, but the way in which they were handled. So my grandfather was recovering from pneumonia at the hospital in Japan and was supposed to come home the following week. And my mom happened to be with him on that day. And the nurse mentioned in the morning that she was a bit concerned with his fluctuating blood pressure. When my mom came back around 6 p.m., she noticed that his heart rate was getting lower and lower. So she frantically kept pressing the nurse call button, but no one came. And so she rushed to the nurse station to find out that no one was there. And the heart monitor at the station was turned off. So she went back to my grandfather and spent the last 3 minutes with him, watching his heart rate to drop to zero. And what turned out that was the resident who was taking care of my grandfather was not sure how to handle my grandfather's condition, but did not notify his attending. And after my grandfather's death, my mom wanted to know what exactly happened. So she asked the attending to let her talk to the resident. But the attending told her that he was worried about the resident losing his confidence and damaging his career. So he did not let my mom speak to him. And as I started writing this piece, I realized that I had a strong message that I wanted to convey to healthcare providers and patients' families. And I wanted to do so by telling my story, like a capturing scene by scene what happened on that day. And writing this, I felt close and distant to my story. Distant because a part of me was doing the postmortem as a public health professional, reflecting on medical errors and systems thinking.
What was the conversation like between your mother and the attending? How did the attending explain the situation?
So my mom really wanted to know the truth. So from the beginning to the end, like from the morning to the moment that my grandfather passed away. And the attending was not apologetic. That is what shocked us. And we were not able to get the whole medical record either. So to be honest, like everything is still like unknown in a way. Like we do know that there was no physician like who was there when that was happening, but we didn't know what exactly happened. And that's what we wanted to know, like, the facts, the story. And since the attending and the resident never disclosed that, we were always in the dark because we didn't know how to resolve that. So that's why like we still have this unresolved feeling.
Did you or family talk to anyone else at the hospital, administrator, or anyone else outside of the resident or the attending?
Yes, we did. We tried to talk to the administration and the nurses who were taking care of my grandfather. But I think in Japan, the authority gradient between nurses and healthcare, like clinicians, or like there's a strict hierarchy. And I know that in the States, like there is, I mean, of course, to some extent, there is some, but in Japan, it's much steeper. So I think when it comes to like medical errors, it's very hard to really pinpoint the specific people or healthcare providers and ask them like what happened.
And then what was the response that you received from the administration of the hospital?
They said, well, it is all up to the resident and attending,
Okay.
and it's up to us to bring up the conversation.
You mentioned that, this happened years ago,
Mhm.
and there's still a feeling that everything is still unresolved. Talk
Yes.
more about that. Talk more about the impact that this event and the subsequent response has
Mhm.
had on your mother and you and your family.
Sure. So to be honest, it is still ongoing battle among us because my mom really cannot trust healthcare providers now, and which is totally understandable. But at the same time, so I come from this public health background, and I told you like I was feeling distant in a way because I was analyzing like about like medical errors and like systems thinking, because when I look at the series of events that led to my grandfather's death, like several key themes like authority gradient, situational awareness, and alarm fatigue jump out.
Yeah.
And so at Hopkins, I took this course by Doctors Albert Wu and Peter Pronovost on patient safety and medical errors, which has had a tremendous impact on me. And I learned that the root cause of medical errors or any kind of instance is not with the individual who made the error, but the systematic or organizational factors that allowed it to happen. So we often use the Swiss cheese model, which is a mental model for system safety. So each cheese layer represents a protective action protocol. So it could be like readback or checklist. And each whole or latent errors represents multiple weaknesses, such as human errors, communication lapse, and caregivers fatigue. And when these holes align, patient harm happens. So to strengthen these layers of protection, we need to focus on like what happens between each incident or lapse and how workflow strengthens or weakens these protective layers. So like Donald Norman, who advocates for user-centered design, said each instrument may be designed quite well and they work perfectly. But when you put it together as a system, it's a disaster. So when I look at what happened to my grandfather, like I think the same thing can be said about hospital staffing too. So like everyone wants to do the right thing, like everyone wants to save a patient, but different key players or stakeholders like doctors, nurses, the social workers, pharmacists, and hospital administration have different priorities. And when they work together without much coordination, everything falls apart. So we have to view these medical errors within the context of the hospital ecosystem because human factors are all interrelated. But it took me about 10 years to come to this point where I can calm down and really, being able to analyze, kind of stepping back and being able to analyze.
Now, speaking again through that public health lens, what
Mhm.
kind of changes would you have recommended that this hospital in Japan undertake so something like this would never happen again?
I believe minimizing the authority gradient. I mean, of course, this is there's always a cultural component, so it is a little tricky to actually implement it. But I think maybe
But in your ideal world,
my ideal world,
what changes would you make to prevent something like this from happening again?
more honest communication among healthcare providers and also with the patient, because right now there's a strict hierarchy that prevents us from communicating like what we fear, like what we are worried about to clinicians. So I think if we can break down those barriers, and if the patients families can like more proactively ask questions, and if you have this like welcoming environment where people can honestly share what they're worried about, like what they fear, what they want to know, I think that will make a huge change.
If you were able to talk to that resident, what questions would you have asked?
I would want to ask, how differently would he want to act the next time he is in this kind of situation? Because I mean, since I've never talked with that resident, I don't know where he was coming from, like where his mindset was when that was happening. And maybe he felt this authority gradient towards boss, like attending physician. And maybe like that's why he did not bring up. So I really want to know, how exactly is he going to use this lesson for his future patients? Because I know that no one is perfect and there's always like a learning opportunity. And like I know that all healthcare providers want to do the right thing. And like I really want to know how he can use this lesson to save future patients.
If you were to talk to the attending again and the attending offered an apology, would that have made a difference to your mother and your family?
I do believe so. I do believe the simple word of I'm sorry, like, would have made a huge difference. I know there's so many liability issues like medical malpractice litigations, and physicians might be reluctant to everything. But I believe that patients and family members won't sue you just because there were some errors. When you do not openly discuss what happened, that's when you feel betrayed, like disappointed, angry, and hurt. And all we want is the true story and the simple word, I'm sorry. So, I mean, at the end of the day, family members and healthcare providers want the same thing, which is to save human lives one at a time. So, I, and so like simple apology and disclosing all the facts would have made a huge difference.
We're talking to Alisa Sano. She's a public health research assistant. Her Kevin MD article is titled Don't Lie About Medical Errors, Apologize. Alisa, so for those healthcare professionals, physicians, residents, medical students who may be listening to you and your story now, what kind of lessons can they learn from hearing all about this?
I would say patients and their family members know that you, as healthcare providers, are heroes, but also human. So talk to us as you're talking to your parents and your friends, and including what you're unsure about and what you fear. And to anyone whose loved ones are at the hospital, like fight for your loved ones, fight for yourself, and share what you fear. Like ask questions, like ask your healthcare providers to share what they're unsure about and ask them what they fear.
And my final question, tell us some of your take home messages that you want listeners to come away with.
Have two-way conversations with healthcare providers and just ask them what's on their mind, and ask them to share what they fear and also share what you fear.
Liza, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you so much, Kevin.